everyone, this is Dr. Vidya, and I'm excited to share with you some insights and my experiences that I have been witnessing while treating asthma and allergies. You may wonder what allergies and asthmas have in common beside making you miserable. A lot, as it turns out, allergies and asthma often occur together. The same substances that trigger the hay fever, symptoms such as pollen, dust, mites, or even pet dander. So, the signs and symptoms of asthma appear along with the skin or the food kind of allergies. So, then it is called as the allergic asthma or allergy induced asthma. How does an allergic reaction cause asthma like symptoms? An allergic response occurs when immune system proteins, the antibodies, mistakenly identify a harmless substance such as a tree pollen as an invader. In an attempt to protect your body from the substance, antibodies bind to the allergen, and the chemicals released by your immune system lead to allergy like signs and symptoms such as it could be nasal congestion or a runny nose, itchy eyes, or sometimes skin reactions. For some people, this same reaction also affects the lungs, airways, leading to asthma-like symptoms. You develop allergies when your immune system overreacts to the presence of harmless substance called allergen. Some people may experience breathing problems like when they inhale these allergens. This is called as allergic asthma. It occurs when the airways swell up as a part of allergic reaction. In general, inhaled allergens cause allergic asthma. Some allergens that can cause this condition are the ones that we ingest, like the dairy, eggs, shellfish, wheat, tree nuts, or it could be tobacco smoke or air pollution, scented lotions, fumes, sometimes cockroaches. Even though an asthmatic reaction to these allergens is less common, they may cause more serious reaction. So, what are the symptoms of allergic asthma? Well, allergic asthma and regular asthma have the same symptoms. They include wheezing, coughing, chest tightness, rapid breathing, shortness of breath. If you have hay fever or skin allergies, you might also experience itchy skin, rash, flaky skin, runny nose, itchy eyes, and even watery eyes. What are the potential complications of allergic asthma? Well, allergic asthma can have serious complications. One complication is anaphylaxis. This type of severe allergic reaction may have symptoms such as hives, mouth or facial swelling, difficulty in swallowing, anxiety, confusion, diarrhea, fainting, nasal congestion, and also slurry speech. Untreated anaphylaxis can cause life-threatening diseases, abnormal heart rate or low blood pressure, rapid pulse, or even sometimes cardiac or pulmonary arrest. So, what are the foods to avoid? People with food allergies may also have asthma. Like I said before, the most common allergen includes dairy products, and all forms of dairy include curds. Incidentally, this topic has been well covered in Ayurveda too. So, it's also a good idea to avoid foods that can cause gas, that could cause bloating inside your body, which includes sometimes cabbage, onions, and beans. Also, artificial ingredients such as chemical preservatives or other flavoring agents. Some foods may trigger asthma-like symptoms, should be avoided. However, it's best to consult your doctor before you start eliminating certain foods from your diet. Asthma is also caused due to dyspepsia and hyperacidity. A lot of people actually ignore this fact. Food that causes gas in your stomach, distension in your stomach, eating very large meals, or foods that can cause gas put pressure on the diaphragm, especially if you have an acid reflux. This may cause chest tightness and trigger asthma-like flares. Sometimes people have allergy to beans, cabbage, carbonated drinks, onion, garlic, and even fried foods. Sulfites, these are actually in processed meats, sausages, dried desiccated foods, excessively processed, pickles sometimes, and even vaccines. A number of vaccines can also have reported adverse allergic reactions. So I'm not removing any of these, I'm just adding whatever causes. So yes, it is also possible that There could be IgE mediated reactions and can cause allergic reactions. Primary allergens are actually proteins, even salicylates in drinking beverages, artificial ingredients. And so these are the things that people have allergies and can develop allergic asthma like symptoms, and it can also cause skin allergies, flares, hives, etc. So the power of fruits and vegetables help to prevent and treat diseases. So let's talk about how do we prevent or treat allergies and asthma. So if adding a few more servings of fruits and vegetables may help asthma, what about a diet centered around plants? I will tell you why. A study conducted on 20 patients with allergic eczema were placed on a vegetarian diet. At the end of 2 months, their disease scores, which covered both subjective and objective signs and symptoms, were cut in half. Similar to what we might see when using one of the most powerful drugs. The drugs work much quicker within 2 weeks, but since drugs can often include dangerous side effects, the dietary options are more attractive. So, what about using a more conventional plant-based diet against different allergic diseases, including asthma? So, in Sweden, there was an active health movement that claimed that a vegan diet could improve or cure asthma. This was a bold claim. So, in order to test this, a group of orthopedic surgeons at Linköping University Hospital followed a series of patients who were treated with a vegan regime for almost 1 year. For more details, you could go ahead and watch Dr. Greger's video where he speaks about treating asthma and eczema with just plant-based diets. Participants in that study had to be willing to go into a completely plant-based, physician-verified asthma for at least a year's duration, and that was getting better or getting worse despite the best medical treatments available. So some patients said that their improvement was so considerable, they felt like they had a new life. One nurse had difficulty at work because most of her co-workers were smokers, but after the plant-based diet and the regimen that she followed, she could actually withstand the secondhand smoke without getting any allergic reaction and attack, which used to happen before. And she was able to tolerate other asthmatic triggers. Others reported the same thing, whereas previously they could only live in a clean environment and felt isolated in their homes, they could now go out without getting asthmatic attacks. The researchers didn't find only subjective improvements, they also found a significant improvement in a number of clinical variables. Most importantly, in measures of lung function, vital capacity, forced expiratory volume, and physical working capacity, there was a significant drop in the marker that the inflammation markers. And Ayurveda approaches have regained their popularity with their efficacy and safety aspects being supported by controlled clinical studies. Ongoing research worldwide have proved valuable clues regarding the precise mechanism of the action of Ayurvedic herbal alternatives. These herbs have shown interesting results in various target-specific biological activities of bronchodilation, cell stabilization, anti-inflammatory, antispasmodic, anti-allergic, immunomodulatory actions, and to some extent also to reduce the cytokine storm. So there are drugs like Pushkaramula, Bhargi, which have anti-allergic activities in experimental models. The mechanism of action of one drug, a Padmapatradi Yoga, is not very clear, but then it shows bronchodilator, anti-inflammatory, antihistamine kind of activity. So there's another drug called Shirisha, where the bark is being used is an excellent immunomodulatory capability. So with all the new findings on alternative medicine and natural remedies, you may wonder if there's a natural cure for asthma. Unfortunately, there is no cure for asthma at this point, because even with super effective treatments, it can only help to postpone an attack of allergic asthma. Reverting to old habits of wrong, unsuitable foods and lifestyle will get you another ordeal again. So it's actually highly advisable to avoid any treatment or product, natural or otherwise, that claims to cure asthma, because it is very important to know that you can control asthma with the right diet, lifestyle, and the right use of herbs or any medication. So, apart from this, it's very important how you maintain your emotional health, because any emotional stress like thing can actually trigger. It's important to also manage your emotional and mental health by doing yoga, meditation, breathing exercises like swimming that can improve your lung capacity. So, with that, I'll end this little topic on asthma